So this is PowerPoint about tennis elbow. I'm Dan Carter, and this is some basic information on tennis elbow. So first of all, tennis elbow, what is it? So its real name is lateral epicondylitis. It's a common condition causing pain on the outside of the forearm where the lower arm joins the humerus. It's just below the joint line of the elbow, and you can see on the diagram there, you can see a nice picture of it there, and you can see where it's marked as a painful area. It is caused by repetitive movements, so obviously sports, tennis obviously being the most common, and also occupational activities, so for example using hand tools might cause it. Movements that are involved in the causal factors are repeated dorsiflexion, repeated radial deviation, and supination. So tennis elbow is common in, as you can see from the pictures there, so it's people common with plumbers, carpenters, people who are digging holes, and of course people who have dogs that pull. Obviously, it is also common in novice tennis players, normally with a poor backhand technique. If you think about people who are digging holes, the most common cause of it with regards to that are when people are digging holes and then they suddenly hit something hard when they're striking the ground with the spade, and it jars up through their forearm into around the radial head area and causes the problem. So, the etiology, or the cause of the condition, has been debated for many years. Here are the most common injured sites. So the extensor carpi radialis brevis, which you can see on the picture there, the extensor digitorum communis, the extensor carpi radialis longus. Less common causes include nerve entrapment, so it could be the radial, the ulnar, or even the medial nerve. Bursitis, a dysfunctional movement at the radial head, is actually quite common in my experience. But all of these conditions, they ultimately cause overuse and the development of fibrous tissue to form around the common tendon. Tennis elbow is a common injury. It affects between 1 to 3% of the population, which as far as injuries goes, quite a lot. It's normally seen within patients from 40 to 60 years old. Men are twice as likely than women to suffer from it. If it is treated badly or allowed to settle in, it can take 1 to 2 years to resolve, which is a huge amount of time. With regards to tennis, 13% of elite players have reported it, and 50% of non-elite players have also reported symptoms at some point. In the tennis playing community, the average symptoms last for up to 2.5 years for 50% of the cohort. So that's quite a serious problem. Right, standard tests for tennis elbow are listed below. So we've got the resisted wrist extension, which we'll talk about more in a moment, Mills maneuver, Maltze's test, and then this one here is specifically the chair test. And what happens is that you pick up a chair, like this guy in the picture. You can't see the picture, but he's holding a chair, and you find that it causes a severe amount of pain through the elbow itself. So Cozen's maneuver. So that you can see the picture here. The therapist extends the patient's elbow, pronates the forearm, and then flexes the wrist and fingers. The reproduction of the pain is a positive test. So that person basically pushes up against the therapist there at the wrist, and that reproduces the pain, and that is a positive test for tennis elbow. This is my personal favourite, Maltze's test. So the patient resists extension of the middle finger distal to the proximal interphalangeal joint. In other words, that middle finger, the last joint of it, you press it up, and if the arm is straight, it reproduces pain on the lateral epicondylitis. So there's lots of ways of treating this. You've got to break it down into the acute phase, the subacute, and the chronic phase. But as far as the acute phase goes, which is what we're talking about here, first thing you've got to do is have a little rest from repetitive action. So if it's a tennis, then you need to back off your tennis for a bit. Ice it on a regular basis up to 4 times a day, but no more than 8 to 10 minutes at a time. You don't want to over freeze it. The gold standard is to use a rather expensive piece of equipment called a cryocuff, which allows you to ice it for much longer. I've suffered with elbow pain for 20 plus years. I have always found the use of taping and strapping to be one of the most effective ways of dealing with it. So that's very beneficial in my opinion. In the subacute and chronic phases, a carefully designed rehab treatment program is necessary. So a graded program of slow stretching exercises, isometric exercises initially, so basically tensing without any movement of the joint, isotonic and then eccentric exercises. Ice massage after the rehab sessions can help reduce inflammation. So with regards to manual therapy, then yes, of course, there's a huge variety of manual therapy that helps. Everything from cross-friction massage, manipulation of the radial head to articulation. Again, personally, I've suffered with this for a very long time, and there are few treatments that are as good as having a good therapist pull your elbow around. It is definitely one of the most effective. I've had 2 bouts of surgery on mine, and it is definitely the most effective way of treating it, in my opinion. If the problem is related to tennis, and this is important, careful examination of the player's backhand technique is required. Also, you need to adjust or lessen the tension of the strings in the racket and make sure the grip size is correct. There are various other forms of treatment for tennis elbows. So electrotherapy can be useful, ultrasound laser. Now, I actually went out and bought myself a Shockwave therapy unit, which I obviously use in clinic. But specifically, if I'm being honest, I bought it to use on my own elbow. And like manual therapy is one of the things that really do make a difference to my elbow. So I strongly recommend Shockwave therapy. There are certain patches, nitric oxide, sorry. These have some effect on tendinopathies. They're not hugely effective, but they do help. And then of course you've got the steroid injections, which there's a question mark over their benefit and certainly how many times you use them, but they can be of use.